Welcome to another edition of the EasyConnectMD.com video podcast. Minute Gabe Farias, Dr. Daniel Kellum Jr. from Kellum Family Medicine. Of course, this podcast is brought to you by EasyConnectMD.com. Couldn't be easier. Couple of easy steps and you can see a provider. $39.95. Visit EasyConnectMD.com. And Dr. Kellum, with everything that's going on right now in the world of medicine that is just driven by COVID-19, EasyConnectMD.com and telemedicine platforms are incredibly important to help us provide information and really to help us get through this pandemic.
Absolutely are. You know, in this time, questions are abounding. Certainly people have a lot of concerns. Not a ton of good information, in my opinion, out there affirming all the truths about what's happening in terms of vaccine or disease. And something like EasyConnectMD for a very low price, people can get on and get their questions answered by a licensed professional. And it's one way that I think we could begin to settle some of the alarm and worry that's happening around COVID-19.
Yeah, and COVID-19 obviously dominating everything that is, it's dominating life. It's dominating politics. It's dominating everyday life, kids going back to school. So what we've done, our marketing director, Michelle Watson, reached out to a lot of our patients and asked for them to provide us questions on the vaccine, on the illness itself. One of the biggest questions that we get all the time, because we get both vaccines, the difference between the Pfizer and the Moderna COVID-19 vaccine. What are the differences between the two?
You know, between both of them, they're essentially the same vaccine. They're a messenger RNA vaccine, which is a little genetic code, a genetic information that gets put into our cells. Now, I say that with, and I know some people worry about that, but it's a very benign process where it goes into our cells. It produces genetic information, so our cells produce a protein. That protein then becomes what our body starts to fight, and it triggers these antibodies, and that is what allows us to fight the coronavirus. So the Moderna and the Pfizer are essentially the same vaccine, aside from the delivery. So the Pfizer is at day 1 and day 21, where Moderna is at day 1 and day 28. There's another vaccine through Johnson & Johnson that's coming for emergency use, I think fairly certain through the FDA, and that uses a little different technology. It's something called a viral vector, and so a very benign virus. So it's what we call an adenovirus, kind of a cold virus that we get, and it's a very benign virus, but they use that to deliver the messenger RNA to the cells. That tends to be less effective. The Moderna and Pfizer tends to give us about 95% efficacy when it comes to protecting us. And what some of the studies show is 100% efficacy in terms of reducing severe disease. And so it's really important, because although people may get it,
it gives you that protection.
Yeah, they go on to some of the serious consequences that we've heard about through COVID-19. And so that is the technically and practically the difference between the vaccines that are out there on the market.
We get this all the time. I get the vaccine. Okay, I'm covered. I don't need to wear a mask. I don't have to socially distance myself from people. That's not the case. You still have to adhere to those protocols to keep everybody safe, regardless of whether or not you've had the vaccine or not.
That is true. So the recommendations are, even though you get it, you still need to wear a face covering for sure. CDC is kind of changing some of those recommendations in terms of quarantines post-vaccine. But until we reach that so-called herd immunity within our community, it is really important that you stay cognizant of protection in terms of wearing a mask. For yourself, you're a little more safe for sure, and your risk goes down a week or two after that second vaccine. But I think it's good, both meeting some of the governmental requirements to lay down in terms of mask wearing, but also just good practice, so that you can make sure that until everybody gets vaccinated, we're not having to worry about that. But we do know that people that are vaccinated really tend to limit that spread. And so that's why having herd immunity and getting out into the communities and doing these vaccines that we're trying to do through Kellum Physician Partners is a very important part of stopping the spread of such a horrible disease.
But you can still get it, and that's the important thing. You have both vaccines. You're going to get it, and you may not even face a symptom at all, because that's in essence what the vaccine is for. If you do get it, it allows your body the ability to fight it. Right. So they do recommend you still wear the mask, because if you have it, you could spread it.
That is very true. So the recommendations are post-vaccine, still wearing the mask. But in saying that, I think what's really important, because one of the biggest things that we're dealing with, quite frankly, is more the mental health aspect of this. And so what we do know is that when you get the vaccine, you can feel a little bit more confident being a part of your family, having family members come over. I mean, those are the things that we really are trying to achieve. And so I think people can feel assured that that part of it can be safe. in the context of social distancing and mask wearing. There is a little debate in the medical community about that, but that's what we're trying to achieve with the vaccines. And I think the more that people get it, the better we are. But once your family is vaccinated, I think there's a whole lot more comfort in visiting your elderly parents or in-laws, or having kids visit their grandparents again, because that part of it, I think, is needed in terms of the well-being for both grandparents as well as family members themselves.
I love these practical questions. Do you think this is going to be an annual vaccine similar to the flu vaccine?
There's no data out there right now that shows that, although there is some protection that we're seeing, and it's a relatively robust protection that people get after they get the vaccine, and in people that have caught COVID-19. My gut is that it's probably going to be more of an every 3-year vaccine as opposed to an every year vaccine, but that's my personal opinion, and there's no direction from the CDC based on that just yet. But being in the trenches kind of doctor doing this all the time, my feeling is that people will last beyond a year in terms of that protection, but the data is not out there to support that yet. That's just a gut feeling.
I've noticed, and again, it may lead to my wimpage, I guess, if you will, is the best way to describe it. I know you've had other words to describe my durability.
Wimpage can handle the magnitude of your wimpage.
But obviously, I have it, and I got both doses. Second one just knocked me for a loop. Yeah. My father, a 75-year-old kidney transplant, Vietnam veteran, toughest guy that I know, gets it. He's like, I'm okay. But I've seen other elderly folks not quite as affected from the after effects of the vaccine. Is it affecting elderly differently than it's affecting younger folks?
The vaccine itself?
I'm talking about the side effects.
That's a really good question. First of all, your dad's just way tougher than me.
He's way tougher than me, Joe. You're way tougher than I am. That is exactly right. Understatement.
You're terrible at mistests for everybody else. But the side effect issue with the vaccines, I would have to say, I was down for 24 hours when I got it done, and you're going to expect, and people should expect after the second vaccine, to feel a little bit tired, headache, sluggish. Usually lasts for a very short period of time. But it speaks to the disease process in and of itself. We don't know who's going to get affected, who's going to have terrible outcomes, who's going to have a short outcome. And the same with the vaccines. We don't really know who is going to feel worse than others. Surprisingly, you actually tolerated it better than I expected you to.
Really?
Yeah.
The tears were only, 4 or 5 days? Yes. You were thinking about like a whole week long worth of tears?
Not a month, but you did really well.
Okay, thank you.
That. Congratulations.
Is there ever an instance where you would tell a patient, I don't recommend the vaccine for you?
Oh, gosh. Well, certainly if you have an allergy to it the first time and it's life-threatening, by all means, I would tell you that that's not the case. And if you have active COVID, that is not the time to get it. But this is one of those vaccines that really, I can't see any scenario where you would prohibit people from having protection, because there is no scenario that protects you from getting the disease. And so in that case, we want to get it to as many people as possible in a safe and very effective way.
Variants. People are hearing about variant kind of facets to this disease in different parts of the world. How will this vaccine help with some of the variants when and if they get to the United States?
That gets into the public health range more than it does me. But from what I know, what happens is if you limit the spread, you can limit the possibility of the mutation of this virus. And in doing that, then you limit these individual strains from developing and coming to the U.S. or even developing here in the U.S. and spreading. What I think we have seen so far is that the different strains are fairly well covered with the vaccines that we have out there. The J&J shot, the Johnson & Johnson vaccine, I think has some limitations to some of the certain strains, but some of that is in testing, I think, more than in practice that I've seen. But the best thing that we can do for everybody is just get as many people vaccinated to what we have over time, much like the flu vaccine. They will tweak it to really get it really tight in terms of the coverage that's needed out there. And that will go back to the question earlier of the frequency and need for the vaccine. And it may not necessarily be protection, but just added protection as we do with the flu shot every year. So what we see that comes from south of the equator, north of the equator, that's what helps us determine what that seasonal variant will be.
I got you.
So as they kind of figure that part out, we tend to get protected that year, and that's how that cycle tends to work, at least with the flu shot. My feeling is that that'll be very similar with the COVID vaccination as well.
Why is it that, and this will be the last question I ask, why is it that they hit that age at 16. So 16 or 17 and up can get the vaccine.
Right.
What was the determining factor on the age? Because I know a lot of parents are saying, why can't I get my 14-year-old son vaccinated?
So studies were really the key. And so when they
Yeah.
were trying to get it out, what they were looking at is the studies in the most vulnerable population, I believe. And what we saw were kids were affected, but their death rates were super small, if not
Yeah.
negligible. And so they were really trying to study that in the elderly population and the adult population, because that seemed to be the most affected at the time. They are now doing studies in 12 to 17-year-olds, and then they'll look at it in pediatric age populations. But because we know that they have such a robust protection, and some of that just has to do with immunity and how you have it as a kid, and over
Yeah,
time it tends
yeah.
to wane a little bit. But that was really the targeted population. I think that eventually kids will be protected, but for now, that's not indicated in the vaccines that we have there. The Pfizer is 16 and above, the Moderna is 18 and above. But really, kids are always our concern, but certainly not the ones that are most affected at this point.
Okay. Gonna switch gears right quick. We've recently started a component to our practice, Kellum Cares, which is our philanthropic arm, where we're going out, and it's very practical in the sense that we go to communities and we help communities, whether it's going to poor areas of town and giving physicals for kids. In this case, we recently went on a trip down to Zavala County to Crystal City, and we vaccinated 700 people in a really unique partnership that was at the precipice. Yourself and Senator Roland Gutierrez. It involved the University of Incarnate Word. It involved Zavala County and Judge Joe Luna.
Right.
Talk about that wonderful trip and that mission we took down there to go help an area that really needed help.
You know, it was an honor to be asked by Senator Gutierrez to take some of our allotment of vaccine to go help this underserved community. It was a community that hadn't gotten much vaccines and certainly much penetration in terms of protection. And so he asked us, we went down and met with Judge Luna, who was a wonderful man down there.
Yeah.
And they were very receptive to our help. Incarnate Word, University of Incarnate Word School of Medicine, as a wonderful partner for us, stepped up and helped us with volunteers to go down there. And our staff, as they always do, Gabe, stepped up to go help people in need. And it was just a wonderful opportunity for us to get down there to vaccinate a population that was otherwise unremarkable. And what's really important for me is that, you know, people of color have been disproportionately affected through this whole pandemic.
Yeah.
And not for any reason other than just, I think, status of health. And the converse to that is that people of color, I think, are disproportionately skeptical about this vaccine as well. And so for us to be able to be leaders, to get out to areas that are underserved, that may otherwise have questions, for us to show that it's safe and show that it's effective and show that people care. And in particular, Senator Gutierrez, who led that charge,
Yeah.
I think really lets them know that everything will be okay. And for us to just be asked to be a part of that was really an honor and a blessing. And so our Kellum Cares program is in our charitable arm was really the arm that we led with that, because there's certainly an organization, thanks to you, I have to say, that has really grown to help our community, and you know, that's what we're here for. And if we can't make a change in medicine when it's the worst out there, then you know, I don't think we're doing our jobs as doctors. And so it was a wonderful opportunity to help someone who really cares about his constituents, and you know, if asked again, we will be out doing it again.
And our staff just could not have stepped up in a more bigger way to help with this initiative. Didn't complain, just went down there because it's the right thing to do.
Absolutely the right thing to do. And you know, as always, they step up big for anything that we ask, and they surprise me all the time in how many people and the heights that they can reach in terms of how much they care and service individuals. And so we're very lucky.
Yeah, we are.
To lead people who really don't need leadership. Certainly our leadership at times, but you know, you give them a mission, you give them an opportunity, and you give them what we want to do in the community, and they ran with it, and they're still running with it. And so, you know, it's just nice to be surrounded by people that have similar servants' hearts in terms of helping our community, and to be asked by someone who has that very same vision is just a godsend. And so, and it really is not for us, but for the people of South Texas. And,
Yeah.
and we will continue, as we said, to be out there serving them through our Kellum Cares program, because of the leadership of people like Senator Gutierrez, and because of the vision of schools like University of Incarnate Word School of Medicine. You know, we'll be able to help those people that can't necessarily help themselves, and that's what we have to be here for.
Yeah, when you told me when you first hired me a few years ago, because you and I have been friends for a long time, and I've known that the impact you have out in the community. But when you said we practice community medicine here at Kellum, I didn't understand what you were talking about at first. now I do. You truly want to serve not only this community, because if we have a healthy Texas, then the economy is going well, schools are going well, things are just going well for everyone as a whole. And one of the things that you've provided as a continuation of community medicine is a great telemedicine portal, which is easyconnectmd.com. And it's something, it's $39.95, and it's something that all Texans, I mean, it's literally telemedicine for Texans with ease and with the ability to see a provider and get a script all within 15 minutes. It's a pretty cool service.
I mean, yes, I agree with you, and I thank you. And it certainly is. Need for healthcare, access to healthcare has been a big issue for a lot of populations, and especially during this pandemic where people losing their jobs and they don't have healthcare. A simple, affordable means where you're not worrying about your children being sick, worrying about them being able to get medicine, worrying about your blood pressure, your anxiety, or the things that can be dealt with relatively simple in a face-to-face meeting virtually is something that I don't think is acceptable. And so for us to be able to provide that platform so that people can get care, so that you can move on with your lives, but more importantly, not be that mom who has kids that are sick and wondering what you're going to do, because dollars are limited and you have to make a choice. That is not what we're here for by any means. And for us to be able to develop a service that satisfies that need is exactly what we're called to do. And this is our service and our call to medicine. And hopefully we'll be able to continue to do those things for the community and continue to find partners that believe in what we believe in and are able to service what we're able to do. Community medicine, by all means, is what we do, because it is the community that raises us up. And if we're not able to give back in the way that they deserve, and quite frankly, we're honored to do that, then I don't think, again, we're doing what we're supposed to do. And so it's been a blessing that we've had these opportunities, and it's been a blessing that our staff has been able to capitalize on that. We have come along for the ride, quite frankly. But it is truly what we do at Kellum Family Medicine.
Fun stuff. Dr. Kellum, thank you so very much. All right, folks, that'll do it for this week's edition of the EasyConnectMD.com video podcast minute. Remember, $39.95. You can see a provider quick, 15 minutes. You can even have a script written, called. You're on your way to the pharmacy, all in about 1 hour. For Dr. Daniel Kellum, I'm Gabe Farias. Stay healthy, folks.
Hello, my name is Dr. Daniel Kellum, and I'm proud to introduce you to EasyConnectMD.com, powered by Kellum Family Medicine.
If your goal is to make life less hectic, then EasyConnectMD.com is for you. For those non-emergency ailments, log on to EasyConnectMD.com and see a licensed medical professional from your home or office. With EasyConnectMD.com, there's no need to miss work or school or spend hours at a minor emergency clinic. Get medical care online and on time at EasyConnectMD.com.